This is a composite class 3 procedure. We will be performing a MFL composite on tooth number 8. As the dentist enters, we will adjust the light and perform the topical and local anesthetic procedure. After approximately 1 to 2 minutes, we will pass our anesthetic syringe. As the anesthetic takes place, we will then take a shade guide using natural light to select the best shade for our patient. After selecting a preliminary shade, the dentist will then decide that this is the final and correct shade to use.
That's good.
Okay. Once you have selected a shade, you will then pick the correct carpule and put it in the composite gun to prepare for the procedure. We will adjust the light and place isolation. Pass the mirror and explore. Pass the high-speed handpiece and suction. Pass the slow-speed handpiece, suction, and use air. Rinsing as necessary. Then pass the spoon excavator. While the dentist is using this spoon, you should always use short blasts of air to keep the field clear. After all decay is removed, you will then perform a limited area rinse and dry the tooth thoroughly. In this procedure, we will use a clear mylar matrix strip, passing the strip to the dentist, and then passing the wedge and cotton pliers. After our matrix system has been placed, we will pass the etchant to be placed onto the tooth. Our etchant should remain on the tooth anywhere from 15 to 20 seconds. After 15 to 20 seconds, the assistant will then rinse the tooth thoroughly for at least 10 to 15 seconds, and after thoroughly rinsing, will then dry the tooth. At this stage in this procedure, the tooth has to remain completely dry in order for the composite to work. Then you will mix your base, which in this case we will use Di-Cal. And pass to the dentist. While the dentist is placing the Di-Cal, you could always have the pad down here for the dentist to grab excess material as needed. Once the dentist has completed that, you will prepare the bond material and pass it to the dentist. Once receiving your Di-Cal instrument, make sure to clean it thoroughly. The bond material that we use has to be light cured. So in this case, we will pass the curing light to the dentist. While the bond is curing, prepare your composite gun for transfer. While the dentist is placing composite, coat your plastic instrument lightly with some bond material so that the composite will not stick to our plastic instrument. retrieving and passing between the plastic instrument and the composite gun until the preparation is completely filled. You can either do the single transfer or you can use both hands if you are not needing to suction at that time. The dentist will let you know when the composite material is done. After complete, you will need to cure the composite. The dentist will then cure the composite. After the curing stage is over, we will remove our wedge and matrix. The dentist will then need to smooth the composite that they have placed and adjust to make sure that the occlusion will be correct after the composite procedure is through. After adjusting with the high-speed handpiece, the assistant will then pass a finishing strip for the dentist to smooth the interproximal area. We will then remove isolation and check the bite of the patient. Make sure to place the metal bar out of the mouth and instruct the patient to lightly tap and grind side to side. The dentist will then verify the bite is correct. If it is correct, we will then use a wet cotton roll to clean up any excess blue marks off of the teeth, and then perform one last full mouth rinse. After the procedure is complete, we will then give post-op instructions. Mr. Jones, your tooth is numb and the filling is as hard as it will get, so you can eat at any time. If you have any questions or issues, please let us know. You will document in the chart the date, tooth number, tooth surfaces, the material that you used to fill, topical, the regular anesthetic, etch, die-cal, bond, and then post-op instructions with your initials. This completes the Class 3 composite procedure.